Welcome to The Kick, your expert-led podcast helping you explore and learn everything about getting pregnant, pregnancy, birth and becoming a parent.
On the podcast and our online pregnancy program, Grow My Baby, we share my experience of helping more than 4,000 babies to be born.
And our experience of running a women's health clinic and parenting 4 boys.
We're here to help everyone to feel empowered in pregnancy and birth with real-life practical information.
In the early stages of pregnancy, you will question every symptom you are feeling. The symptoms are sometimes the fodder for comedy routines, and one day you might look back on them and find them funny. But when you're in the midst of early pregnancy symptoms, it is rubbish. This podcast will talk about the common symptoms and which ones you need to seek help for. So, Patty, this is something that patients talk to you all the time about, isn't it?
Yep.
You know, it's a common conversation starter for women when they're talking to their friends about, what they're feeling during their pregnancy.
Sure.
And some of them are just, unfortunately, part and parcel of being pregnant. But we'll go through some of those and then we'll talk about the ones that we're concerned about.
Good.
But the first thing that I wanted to talk about is really we're just talking about the early pregnancy symptoms. So can you define what is early pregnancy?
Yeah, I think what we're talking about today is those ones, the first trimester, or 0 to 12 weeks of early pregnancy symptoms, mostly because they can start right at the start, but they're mostly gone by 12 weeks.
Yeah. I remember my first pregnancy. The others are a little bit of a blur which symptom came first. But in my first pregnancy, I remember I was panicking. I was getting ready for work. I was running late. I just woofed down breakfast and then I ran out the door, and we lived in a little tiny sort of terrace, and right next door was this gorgeous Greek couple, and they were fabulous fishermen. And they'd put the sort of fish in the bin, which was on the street, and I ran past it and I smelt the fish and I vomited into their garden. I couldn't look them in the eye when I came home. But, after that I thought, hang on a minute, that's very unusual behaviour for me. What's going on? And then, the next day or so I found out that I was pregnant.
Yeah, I think that's not uncommon. People will often pick up some odd little things about their behaviour or a response to a smell or bladder changes that they might notice even before they've done a pregnancy test, especially if they'd been trying to get pregnant for a while and had stopped testing, on the first day of the missed period.
So how early would someone expect to have some symptom?
Yeah, well, some people definitely report reliable symptoms before the first day of the missed period. Remember, ovulation's in the middle of the month, and whilst we don't tend to start testing until the first day of until the day of the missed period, for up to 3 or 4 days beforehand, people will report symptoms.
So is it an indication of pregnancy?
Yeah, well, that's the hormones at work. So the pregnancy hormones are present in the body and start to change little subtle things about you from the get-go.
I know a lot of women say that the first thing that they feel is that their nipples start getting really sensitive. And I was reading on one of the pregnancy websites this fantastic forum question, which was, "My nips aren't even sore. I don't feel sick. Am I even pregnant?"
Yeah, well, that's the other side of it is you don't have to have any of these things, and it doesn't mean anything if you don't have them. I've had a few patients over the years who've had literally no pregnancy side effects or symptoms whatsoever, but I'd say that's the exception, not the rule.
Yeah. So is there any real sort of variation from woman to woman in the symptoms that they might experience?
Enormous. So you could have somewhere between nothing at all right up to the full list of itching and aversion to smells and needing to pee all the time and change in the taste of food, and you could have some of them or none of them.
Yeah. And before we go into that big long list, because I've got a few that I want to talk to you about,
Sure.
What would you say in terms of general advice for women during their early pregnancy just to look after themselves better?
Yeah, I think, before we get into individual symptoms, I think at this stage it's really important to be focusing on some good self-care things, because the one thing that's universal is the tiredness. So a lot of attention's paid to the nausea and to various other things, but the tiredness, I'd say, is universal. And a plan to deal with that in early pregnancy is really important. So you'll need lots of rest, but you'll also need exercise. Exercise is probably the only reliable antidote to the tiredness. And a lot of taking care of yourself. Hydration is really important.
And hydration, sipping water is kind of a bit tricky. I remember I couldn't really sip water, and then I worked out that it had to be ice cold.
Yeah, so some people like ice cold and other people might prefer warm, just whatever feels right to you. But the important thing is to take multiple little sips throughout the day, which can add up to a few litres, rather than trying to sit down and drink a few litres at once.
Yeah, that definitely I couldn't do. It made me feel really bloated and actually really nauseous when I did that, when I, thought I was so thirsty, because there's this dryness in your mouth that you can get.
Mm-hmm.
And I was just, needing to fill up on water, and yet that as soon as I did that, it made me feel nauseous. So
yeah, so for that sort of low-level nausea, particularly around when you're trying to get water in, eating a fizzy lolly like a fruit tingle can be really helpful. People find it helps to break up some of the tension in the stomach and burp up some of that feeling of bloatedness.
Yeah.
And they're nice. Fruit tingles are yummy.
Not so great for your teeth, though.
Well, brush your teeth.
Now, with fatigue, there's this great story that our good friend Katie tells us, where she'd been shopping and she got one step inside the door and just dropped her bags, and then immediately had to go lie down, and her husband didn't sort of realise what had happened until he got home, and there was bags of shopping just at the front door.
Yeah, right.
Have I recalled that right?
I can't remember that one.
Yeah. So tiredness is all sort of consuming in early pregnancy for some people.
Yeah, absolutely. And you mostly in those early weeks just have to give in to it and rest. But a lot of people tell me that exercise is one of the few things that will actually perk them back up again. I'm not talking about, the gym if you feel exhausted off your feet, but just going for a brisk walk, 20, 25 minutes. Some people will just report that that's one of the few things that can break the spell of that really intense tiredness.
Just getting out into the fresh air too.
Yeah.
That was just such a fabulous antidote, like you said, for me.
The tricky bit for women too is that they often haven't told other people or work that they're pregnant yet. A lot of people want to keep that information private until they've completed first trimester screening or until they're just ready to tell the world. So you have to deal with the tiredness without letting work know, and that's a tricky bit for people.
Yeah, in our Grow My Baby program, we've got a fabulous HR lawyer that we talk to about exactly that. She says that it's good to start a conversation early. If you're suffering from fatigue and you can't manage the workload or whatever it is, sometimes it's about having an open and honest conversation. So
and expecting whoever you tell at work to treat that information with respect and confidentiality until you're ready to tell more people.
Yeah. One thing that it just put me off food really was the metallic taste that was in my mouth all the time. I was mentioning it to a friend last night and she said, "Oh my God, yes, I had that in my pregnancy as well. I didn't know it was a thing." She just sort of put up with it. But yeah, I remember that making me feel like I didn't want to eat anything. Yeah,
that's actually a pretty common one. The pregnancy hormones are very powerful. They are affecting every cell in our body and every cell in a pregnant woman's body, and changes in the way we think about things, perceive things, smell, eyesight, taste, they can all happen right at the start.
When it comes to, all of the movies and stuff they go on about crazy pregnancy cravings, to be honest, I didn't have a single pregnancy craving. I had a few aversions. I couldn't have Asian food in my first pregnancy, which was bad because I love Asian food. But do you get people talking to you about crazy cravings?
Yeah, I think aversions are more common than cravings. And I think, weirdly, the most common aversion, I'd have to say, is that people are really, really grossed out by the smell of meat cooking. That's a really common one. And the woman might be able to eat meat, red meat, which you need when you're pregnant, but she can't stand the smell of it cooking. Don't know why.
Yeah.
So I'll often be advising couples just for the woman to go into a different room, for the meat to be cooked in a well-ventilated kitchen and then served up once that cooking smell has passed.
Yeah, all cooked ably by their partner. That'd be a nice night off. Yeah.
That's right. Yeah, that's perfect. And then the cravings, I don't know, cocktail frankfurts.
Oh, no, really?
Pink sticks.
Oh, my God.
funny things.
Yeah. I did eat a Magnum every night in my first pregnancy, but that was not a craving.
No.
And actually that was good for me to do. I put on more than 30 kilos in my first pregnancy.
Yeah, right. Well, there you go. That's more than recommended.
Yeah.
And, that's not a craving. That's just delicious Magnums.
Mm-hmm. Yeah, so another thing that people report with our big boys, they're 16 and 12 and, 13. And they're watching How I Met Your Mother at the moment. And, I mean, we love that show too. But Lily's pregnant in the episodes they're watching and she's having crazy dreams, pregnancy dreams.
Absolutely. So the most common one of those that I've come across is and it probably just represents our inherent nervousness and psychological vulnerability around pregnancy, is the one where the baby comes out and it can already talk and has a job and things. Yeah. It leaves the house and so forth. And that's actually a surprisingly common dream. And I don't think you have to be Freud to work out that just represents our anxiety about the unknown.
Yeah. Other ones that I didn't experience but friends have told me about is things such as sneezing a lot. What's happening there?
I think progesterone from the pregnancy definitely dries out mucous membranes so that you get a dry nose from progesterone, and that probably accounts for the sneezing and the nosebleeds.
Right. Oh, nosebleeds, yes. Yeah, definitely.
So they're progesterone-mediated ones.
And can you take anything for the drying out of the nose?
Not really. Because it's hormone-mediated, you're not going to be able to sort of fix that, I guess, until the pregnancy progresses or your mucous membrane in your nose adapts. But I've had a bit of success advising people to use the Fess nasal spray. It's a saline nasal spray, just kind of wets the inside of your nose.
Yeah. I remember being very careful about how fast I stood up. I'd get very lightheaded and I'd feel like I was going to sort of topple over.
Yeah, and I think that's part of the body's fairly elaborate mechanisms to change the cardiovascular system during pregnancy. So when you're pregnant, your heart beats a little faster. The stroke volume, which is how much blood your heart pumps out with each pump, is higher. The volume of blood is increased, your blood pressure changes, respiratory rate goes up and so forth. And all of those cardiovascular changes are to accommodate the growing pregnancy, the placenta, the extra blood volume you need to fill the placenta up and so forth. And I think some of those things like feeling lightheaded when you first stand up, we just have to give our body a chance to adapt to being pregnant.
Yeah, because I knew about shortness of breath, but I was surprised that I got that in early pregnancy because I thought it had something to do with the baby taking up room in later pregnancy. But I remember feeling very short of breath at the start. Like I'd walk up a flight of stairs or something and think, hang on a minute.
Yeah, that's right. So there's two different things. There's the one at the start, which is a hormonally mediated increase in respiratory rate and often associated with a sense of, not alarming, but a sense of vague shortness of breath. And then at the other end, it's because the big proper pregnant lady tummy is literally squishing your lungs.
Yeah. Now, what else insomnia. That was very unwelcome throughout all of my pregnancy, throughout the whole pregnancies.
It's probably the cruelest one, isn't it? Because it doesn't seem to serve any purpose whatsoever. In fact, it's sort of actively fighting against you between the funny dreams and and everything. You're really tired and then you can't sleep. And that unfortunately can progress right throughout pregnancy. That's not just a first trimester one for some people. That's just the effect, again, of pregnancy hormones on the thing called the sleep-wake center, which is a little thermostat in our brainstem that makes us go to sleep and wake up again later on. And like every other part of the body, it's affected by pregnancy hormones.
So when I was very early on, I remember feeling just achy all over. Similar to sort of, I thought I was coming down with a cold, or I just didn't know really what was wrong. It was wrapped up with the fatigue.
Yep. Well, that's another common one. And I think that it's really important for people to know that there's a normal, that they'll pass. And most of the really significant ones will pass by 12 weeks. And then you'll get into the later part of the pregnancy and develop a new set of issues. Yeah.
Which we'll come back with another podcast to talk about the symptoms in later pregnancy.
Yeah, third trimester discomfort is a whole other discussion. Yeah.
We were out for dinner last night with our friends and I was saying that we were doing this podcast today on pregnancy symptoms and she said, oh my God, one thing I couldn't do was brush my teeth. She said, gagging. I just gagged on everything.
Yeah. So that's another one I've heard about before. So you've got to brush your teeth. So you've got to be gentle.
Gentle.
Yeah. Use mouthwash, very gentle with the toothbrush. And because, changing the gag reflex is definitely one of them.
And we did talk about other pregnant women having problems with farting.
Not you.
No.
No, I thought I was pregnant once. This unrelated farting issue. So, that's definitely one. So, obviously, digestion is really affected by pregnancy. Again, hormonal reasons, and later on by the big baby squishing the bowels.
Yeah, and I've also heard that it's a bit uncontrollable. It happens in the most embarrassing of places.
Well, potentially, but again, it'll pass.
It'll pass, yeah. I definitely experienced headaches as well throughout the pregnancies.
Yeah, headaches are interesting. They're thought to be progesterone mediated as well, and they probably come during certain phases of the pregnancy where hormonal activity is very high. So people often get headaches at the start, again around about 20 weeks and again around about 28 weeks. And that's what's led to the belief that they're probably hormonally mediated. Options for headaches are not that, you don't have a really broad list of appropriate pain relievers and so forth in pregnancy, but paracetamol is okay if, in moderation if you're having a particularly bad day. Lots of rest.
Water.
Hydration is very important.
So another symptom that some people talk about is excessive saliva.
Yeah, I haven't heard that one being reported by too many people, but almost any sort of thing that you might notice about your body that's distinctly different in pregnancy, then it's a pregnancy symptom without a doubt.
Yeah. And we have people saying, things like in early pregnancy, like it's good that you know that the pregnancy is continuing because you've got all these symptoms. It's not particularly supportive, though, is it?
I don't think that's of any comfort to the woman if she's feeling unwell.
Yeah.
To be told, at least you're still pregnant. I don't know if that's any comfort at all. I think it's nice. I've had a few people who've had really bad runs with recurrent miscarriage or prolonged infertility who've welcomed the nausea as a sign that they are pregnant. But I'm sure the novelty is worn off fairly fast.
Yeah. And these are just symptoms that perhaps just something that will hopefully go within the 12 weeks. Mm-hmm. But what are the symptoms that, as an obstetrician, that you're concerned about?
Yeah, so we've been talking about the ones that are, just of interest and we note them and move on. But the big ticket ones that are alarming to me would be bleeding in early pregnancy, which a lot of pelvic pain in early pregnancy is not normal either. Certainly needs to be checked out. It might have a benign, harmless cause, but a lot of pain's not normal. Can
I just clarify on pain? Because, you've got achy muscles and all the rest, and sometimes it's hard to distinguish between what is just normal and what is something that we should be getting advice for. Yeah,
well, I'm talking about pelvic pain. So severe or significant pelvic pain definitely needs to be looked into.
Yeah.
Okay, it shouldn't be a lot of severe pelvic pain just because you're pregnant.
But you do definitely feel some pain as your ligaments and everything sort of move around, even in early pregnancy.
Sure, and that's the sort of pain that you might, sort of muscular pain that you might experience at any stage when you're not pregnant, and you know that was a trivial thing that you could dismiss.
Yeah.
So severe pelvic pain in early pregnancy could be something serious like an ectopic pregnancy, and that's why we want people to get checked out. So the other one that really goes beyond the sort of normal range is when nausea and vomiting becomes very severe and leads to problems like dehydration and malnutrition. And that's where there's this sort of grey area between severe morning sickness versus an actual medical condition called hyperemesis, which is where the nausea and vomiting has become severe enough to cause dehydration and potentially malnutrition.
Oh, that's what Amy Schumer talks about, yeah.
That's right. We watched her show the other night. Fantastic. So she'd had hyperemesis basically right the way through and in and out of hospital.
Because that's not just a finish at 12 weeks and move on. That can happen throughout the whole pregnancy.
Yeah. So the worst I've seen is people who were just badly nauseated for the entire thing.
I'm going to read something about hyperemesis. So this woman posted, "I'm constantly vomiting 24/7. I can't eat anything or drink anything. Nothing's working for me, not on Dancitron or Maxilon. I am 10 weeks and hoping that things improve when I hit 12 weeks because right now I'm not coping mentally or physically."
Yeah, well, that's someone in trouble, isn't it?
Yeah.
So one of the key sort of take-home messages I love my patients to understand in early pregnancy is that you can't just soldier on through this, and if it's getting to that point where you can't keep anything down, then that needs attention. So what we'll tend to do with a woman in that situation is see her, assess her for signs of dehydration, and there's a medical signs of that, dry mouth and so forth, and then ideally bring her into the hospital for some intravenous rehydration, which we can often do without a formal admission. We can do it through a hospital short stay unit or an emergency department, put in an IV line, give a couple of litres of intravenous fluid and some intravenous anti-nausea drugs. And it's a bit of a grease and oil change. It just gets you a little bit feeling better for a few days. Then the symptoms will come back again and you might need to have it all done again a week later. And then we can also bring in different and more powerful anti-nausea medications.
Can we further distinguish the difference between nausea, which is normal, and hyperemesis?
Well, it's probably a continuum of the same thing where it's then there's a grey area and then it becomes a full-on condition that needs treatment. So what people should look out for is if the nausea and vomiting is relentless, and because of that, you're not able to hold fluids down, become progressively dehydrated, you'll definitely notice that the urine volume drops off and that the urine becomes highly concentrated.
Meaning that it's dark in colour and smelly?
Yeah. If you're pregnant and have those symptoms and you're starting to be worried about yourself, then your caregivers will be worried about you as well.
Yeah, it sounds like a dreadful time that some women have of it where they do have hyperemesis and it's throughout the whole pregnancy. You've just reminded me, though, one thing we just didn't talk about and I can't believe we missed it, peeing all the time.
Yeah, that's one of the super common ones, isn't it?
Yeah.
In particular, people who wake up at night needing to pee who don't normally do that. I've had people who haven't even been trying to get pregnant and they've woken up at night needing a pee and go, I bet I'm pregnant.
Yeah, it's a telltale sign.
Yeah.
So I think we've covered most of the common pregnancy symptoms, but, we'd love to hear from people if they've got other weird and wonderful things. If you feel like you've got something that is an unusual symptom of pregnancy.
Absolutely. Let us know.
Let us know. Now, if you haven't already subscribed to our podcast, The Kick, make sure you search for the show in your podcast app of choice, or you can listen at our website at growmybaby.com.au. And while you're on the website, grab some of our awesome free tools like our pregnancy knowledge checker to help you feel like you got this. Bye for now.
Bye-bye.
Hey, even though Dr. Pat is, a doctor, and we get lots of other doctors and other experts on our podcast, I just need to remind you that this podcast is for informational purposes only. We share lots of medical insights and experience, but everything we talk about is general in nature and may not apply to your specific situation. Please always consult with your own healthcare provider for your individual medical advice when you grow your baby.